Our Secretary of Education, Johnny Key. Let me address a couple things today. First, we want to talk about the legislative session, special session coming up, and then secondly, we'll talk about Omicron, and then thirdly, our case up to date, which will be of interest to you as well. But first, in terms of the special legislative session, I am announcing today that I will call the special session of the General Assembly for December 7th at 10 a.m. They will convene here at the Capitol for purposes of considering a number of items. The lead item and the key reason for the session is the tax reduction bill. I spoke today with both the Speaker of the House and Matthew Shepard and Senate Pro Tem Jimmy Hickey. They confirmed that we have more than a majority vote on both on the tax bills to have that passed. They feel confident with the support for that. And so with both the concurrence in what the bill is, and secondly with the level of support that is committed, I feel comfortable in calling the session with that being the lead issue. I also wanted to mention a few other items that will be on the proclamation for the call. We want the legislators to know as far as in advance as possible as to some of the other items that will be considered. These are primarily cleanup matters and some technical corrections. But one, we will be moving some restricted reserve funds. Right now, without legislative action, the money from the allotment reserve will go into the long-term reserve. We have more than sufficient money in there, and so we want to move that into the restricted reserve account. Secondly, we have a tax appeals commission that was created in the last session. There's an appointment process for that tax appeals commission. There's some technical language that has to be corrected in the appointment process. That will be on the call. The last session they passed what they call as an insulin bill, but it's had an adverse impact on EBD and other insurance plans, and so that will be repealed, and the repeal of that bill will be on the call. The LLC bill, which is limited liability companies, there was a new law that was passed in reference to that, but there was a gap on the implementation of the law that left LLCs in jeopardy that were filed between July 28th of this year and September 1, and so there's a bill to rectify that LLC issue. And then, as everyone knows, we've had significant funding from the federal government from the American Rescue Plan, and we need to pass additional appropriation bills to accommodate the receipt and the disbursement and the handling and investment of those American Rescue Plan dollars. So there'll be some appropriation bills that will follow as well. There will be a bill that will allow the House and Senate to have security personnel. That's at their request, of course, and that takes a legislative change to do that. And then finally, it's not 100% sure yet, but there's a potential economic development bill that will be presented. We're still working on the language of that and developing the details on that. So those are areas that will be considered, those bills on the call, again with the focus being the tax cut bill to put more money in individuals' pockets here in the state. As traditional, the actual proclamation will not be issued until closer to the session to make sure we get everything right and that we have everything in order. Hopefully that can be actually filed this Friday. That would be the goal, but the proclamation will be forthcoming. But I did want to announce the specific timing of that, the details of it, and the fact that we do have a good majority on both houses for the tax cuts bills. With that, let me return to the issues of COVID. And first, I want to talk about the Omicron variant, and I know that Secretary Romero will discuss this as well. First of all, there is not enough information to make definitive decisions about Omicron. I spoke to the White House today, Jeff Zients, and he's keeping the governors informed. There's a good line of communication with the White House on this. The key questions to ask and to get more information on is how contagious is Omicron, this new variant. Secondly, how severe is the disease, and is it more severe than what we have now, or will it be less severe? And thirdly, do vaccines and other therapeutics, are they effective with this variant? And we don't have the data yet for that. Hopefully by next Tuesday we'll have more data and more answers. In the meantime, it is important that we stick with our strategy in Arkansas, which is let's get as many vaccinated as we can. That is the best protection. We're all hopeful that and there's some indications that the current vaccines will be effective against that, but that is our best solution. And if we are not vaccinated, we have to maintain social distance, wear a mask, protect yourself, but the key is let's increase our vaccination rates in Arkansas, and I know, again, Secretary Romero will have some additional comments on that. Let's look at our case report. If we could put up the first graph, you can see that, first of all, our cases are up 1,044 in the last 24 hours, which is the highest number we've had since September. It's the last time we were over 1,000 cases in a 24-hour period was back in September. Now, if I'm the optimist, which I usually am, that could be an accumulation of some slow days over the holidays that we hit this high water mark on this day, and they might not be that high later in the week. If you're looking at it a little bit more perhaps realistically or based upon additional data, the fact that our positivity rate has creeped up to 9.1% raises a concern that the trend line for the positivity rate indicates that we are trending upward. That, of course, resulted in active cases going up, and we had 12 additional deaths that are a regret to everyone and the impacted families. If you look at the vaccinations, and that is what Arkansas is about. As we get more concerned, as we see a threat, we take greater action. And so vaccinations have gone up 12,969. Of these, I'm very pleased that 35.9% are first doses. And that means that we've got over 4,000 going in for the first time and starting the vaccination process. 20.7% are second doses and 43% are third doses. All good signs on the vaccination front. And you can see the total now of 1.7 million totally or partially immunized in Arkansas. And then hospital data, we're up 19. And if you look back over the last week, our hospitalizations are up 18%. We've got to watch that trend. We don't want to get to where we were last winter. And then if you go on to our testing is more robust than it has been. As people of Arkansas get concerned, they worry about the holiday season. We worry about the increasing cases. They go out and get tested more, and so those numbers are up. Pulaski County, 108 new cases in Pulaski County, 85 in Benton, and Craighead, 67. Again, correctional institution, only 10 active cases in our Department of Corrections, so hats off again to the leadership there for the work that they're doing to protect the inmates. If you look at the rolling average of confirmed and probable cases, this simply puts it in graph form. You can see where we were last winter, December, January at the high water mark, around 3,000 new cases a day. And then we had this last surge over June, July, August, September, where we got up to 2,500 cases. And now the question is, are we going to have that additional surge? Next, you'll see active cases are we actually went down in active cases over a week ago, but with the additional cases today, it's going to go back up over the course of the week. Again, just a reminder that primarily the new cases that we have, the new hospitalizations we have, the new deaths we have, are of those that are unvaccinated. And statistically, if you look at data, you look at science, the data says if you want to weigh the risk, if you want to minimize the risk of hospitalizations, just simply get vaccinated, because 86% of new cases are unvaccinated, 88% of hospitalizations are unvaccinated individuals, and 86% of the deaths are unvaccinated individuals. And then just to show you where we're progressing on the eligible population, age 5 and above, combines now at 62%. Last week it was 61. We're up to 62% partially or fully vaccinated. And then just wanted to show this today to the most vulnerable population have taken this seriously, are getting vaccinated. And so if you combine those two, that is 85% of our residents 65 and older have been partially or fully vaccinated, and that gives us greater confidence, but that means that there's 15% of our elderly population unvaccinated that are in jeopardy, and we hope that that can be encouraged. This is the positivity rate that I referenced. I always like to keep below 10%, which is below 10% at 9.1 on the rolling average, but you can see it creeping up, and that's been the trend line. And again, if I was a pessimist, I would say that by the end of this week, we could be over 10% on our positivity rate, and our cases could be up trending again. And so let's take all the action we can to avoid that and to protect ourselves in the event that does occur. With that, let me recognize Dr. Romero, and we have Secretary Key here, who has good news because there's not much news. Secretary Romero.
Thank you, Governor. So some fine points to the Governor's already very appropriate comments. So hospitalizations are up nearly 20% from last week on this day. As the Governor mentioned, this is the first time we've been over 1,000 for a since 2 months ago. I want to point out that 30% of the new cases are occurring in the 5 to 18-year-old group, and we have vaccines for that group. So it's important that parents realize that this virus does affect children. It can have long-term consequences, and that vaccines are available, and we're encouraging them to get their children vaccinated. Also, I want to point out another high-risk group, and that is pregnant women. I mentioned this last week. I want to mention it again. There's a lot of misinformation about the safety of the vaccine in that population. The vaccine is safe and effective. Pregnant women who are thinking of becoming pregnant should consider this vaccine for themselves. With regard to the Omicron variant, we are currently surveilling for it. We have not seen that in our communities, but we are looking for it. We are concerned that this could be more contagious than the current variant, and as the Governor pointed out, we believe that our vaccines are effective against it at this time, and we're encouraging everyone to either get their primary immunization if they've not done so, or to get that booster dose. We need to protect our communities and protect ourselves against this variant. So I'll turn it over to Secretary Key now.
So in yesterday's report of the active cases in our public schools, we were at 705, which is about 500 fewer than the previous week. We don't read too much into that because last week was the Thanksgiving holiday and most districts around the state were out for the entire week. But what we do anticipate that if there had been any transmission cycles occurring in the public schools, that last week gave us a chance to maybe break those. We will be monitoring that number. We have about 3 weeks until the Christmas break, and we are looking forward to a strong finish to this semester. and we'll have about 2 weeks before schools come back after the first of the year. But again, we are encouraging and working with school districts and with the health department team as they schedule immunization clinics and encouraging more of the now 5 through 17-year-olds to get that vaccination so that we can see a good second semester with minimal number of cases.
Thank you, Secretary Key. With that, we'll take any questions.
On the special session, one issue you didn't mention on the call is abortion. There's been talk about a push for a Texas-style abortion ban. Am I correct that that's not going to be on the call? And secondly, if that does get introduced and does get passed, what do you plan on doing with that? Will you sign that?
That will not be on the call for the reasons I have previously stated, which is that we have really the most restrictive abortion law already in place in Arkansas that has been enjoined by the court, being reviewed constitutionally. Secondly, there's a number of cases, including the Texas-style enforcement action and the Mississippi case pending before the United States Supreme Court, and any additional action should await guidance from the Supreme Court. And so that's not on the call for those reasons. If it comes up, then that will be the will of the body as to whether they would add anything to the agenda, which takes a 2/3 vote. I hope that the General Assembly will agree with my analysis that we're where we should be right now, and we have perfect challenges before the Supreme Court, both on our law, the Mississippi law, where they have ample opportunity to revisit Roe versus Wade. Let's wait on that decision, and then we'll know if any additional action needs to be taken by Arkansas or the states. And the same thing applies for any other issue that comes up. I hope that we have a short session, that we come in, we do the business, and we keep our focus on the tax cuts, which was the plan all along. And so hopefully that'll be the case, and we'll work with them to accomplish that.
If it does reach your desk, what would you end up doing?
I'm not even going to comment on that because I don't know what the bill would be. And again, it's not on the call, so I hope that that will not be considered.
The increasing cases today, do you think that we're seeing cases related to Thanksgiving itself, like gatherings over Thanksgiving?
I mean, generally it takes a period of time to assess whether Thanksgiving activities have added to the caseload. Let me ask Dr. Romero if you would want to comment on that.
It may be that we are starting to see them. We know that the Delta virus tends to come on a little bit sooner than the other, but I think the governor is correct that a lot of people held off on testing until after the holiday and now have begun to do that testing. We'll see what happens over the next couple of days. But unlike the governor, I tend to be a half empty glass, and I think that we're going to see more cases in the next few days. So we have to be prepared for that.
You think that we're basically still at the beginning of the surge? We were in before.
I think we're past that beginning. I think if this continues, we are definitely in another surge. Whether we will reach that peak that we did on the summer surge is unknown yet. The other thing, if I may, please, Governor, right now we have beds, but we're also entering flu season. And I think it's very important. I was remiss for not stating that at this podium the first time. Flu can burden our system. We expect a heavy flu season this year because we did not see flu last year, and we had a very attenuated course the year before that. So in the elderly and the adults, those individuals tend to go into the hospital during the winter. That will add a burden to this. And if I can be even more pessimistic, if we happen to have Omicron, that will certainly push us over the edge. So please get your vaccinations for COVID and for flu this year.
There were over a dozen nonprofits that kind of issued a sort of a joint statement saying instead of tax cuts, they would rather see the state fund more, social programs, things of that nature. Is that something that's ever been kicked around, or You know, kind of how do you respond to, you know, that method of thinking?
Well, I don't think it's either or. We've consistently increased our funding of social services in Arkansas. We've expanded pre-K, early childhood education. We've continued to invest in that. We have additional federal dollars to help us with those social programs. We're just allocating additional funds for asking for approval for our food banks. So we are meeting the needs there, and we'll continue to do so. And our budget is in a position that we can meet those needs, and we can also make sure that we can have these tax cuts, which has been the long-term plan all along.
With the rate now, well, the goal at least, to get to 4.9 for the tops of those tables, does this appear to be more of a tax cut for higher income earners now that that top rate is dropping even further than maybe some of the proposals were earlier?
No, I think all the way through our tax cutting plans, we've been balanced with first middle income, and then we gave tax cuts to low income, and then we cut the rate, which benefited some of the higher income. This round is balanced. It does benefit all taxpayers, and you'll see, with the addition of the low income benefit, it's going to benefit the low income taxpayers as well. So those numbers will all be released. I think they're already out there exactly as to which income categories get the benefit for this. But it also puts us in a more competitive position with other states. Other southern states realize the benefit that Texas and Florida have in their low income tax rates. Now, every state is different, and they have different tax structures, and we don't have to mimic them. I've always said, let's get down to 5%. Looks like we're going to be able to get down to 4.9%. But we get down in that level, then we are competitive with those other states. And that's a big part of it, because that benefits when you talk about job creation, capital formation in this state, keeping our talent in this state, that benefits everyone as well.
The economic development bill you referred to, is that a bond project? Is that a super project you're talking about?
No, that would be an Amendment 82. This is not an Amendment 82 project. This is one that will be disclosed later, but it is it'd be looking at the recycling tax credits, an amendment that might be needed there, but that's still being formulated. It's related to a project that will be required to have an amendment to the recycled tax credits. So we'll cover more details on that. That's still being formulated. You'll have more information there.
The insulin bill, what kind of, I guess, can you elaborate a little bit more on what that would be that you're appealing, the impact that's had on the state?
Andrew, we're going to have to get more information to you on that in more detail. Is there any questions remotely? Nope. Anything else here at the table? All right, and we will follow up with getting you some more specifics on that, give you a better answer there. With that, thank you for your attention today, and y'all have a good afternoon.